So now I'm going to shift over to the work of our office. So back in 2013, before I joined Metro Transit, the council adopted a TOD policy. This policy guides the council's broader planning work, but also Metro Transit's implementation work. The reason our work is housed within Metro Transit is because our work has more of a project orientation where we're trying to advance transit-oriented development on land that we own. That said, we do work closely with folks across the council to advance TOD. And we are directly and actively engaged in current efforts to update our regional development guide. The goals of our TOD policy are to maximize the development impact of transit investment, and that's really about integrating these transit investments with jobs and housing and other destinations. The second goal is to support regional economic competitiveness, and that's about leveraging private investment in our station areas. The third goal is to advance equity. We're doing a lot of work on this, but we define it at a very high level as improving multimodal access to opportunity for all. And then finally, supporting a 21st century transportation system through increased ridership and revenue. And this value capture is a really big part of that. So the joint development that we're trying to advance, TOD that we're trying to advance, is an important part of this piece. I outlined our goals, but I think there are a lot of other TOD benefits, and these are just a few of them that are worth considering. The first is that it improves, improving public health is a vital benefit of TOD. Just a couple months ago, the New York Times actually just ran an article on the role our built environment plays in type 2 diabetes. The article reads, "Researchers who study type 2 diabetes have reached a stark conclusion. There is no device, no drug powerful enough to counter the effects of poverty, pollution, stress, a broken food system, cities that are hard to navigate on foot, and inequitable access to healthcare, particularly in minority communities." And this is just a tiny slice of the broader health conversation, which links our built environment to obesity, access to food and healthcare, asthma, traffic fatalities, mental and emotional health, heart disease, et cetera, et cetera. And we can really address so many of these issues through better urban design.